Hey, Goldie here. Thanks for tuning in. So today we're going to talk about what's going on with the states. There's a lot of buzz in the press about them in regards to some are into the health care exchanges, some are not into it. Two states in particular, Tennessee being one and North Dakota being the other, have just made a lot of news. In Tennessee, they're just about ready to approve a bill called the Health Freedom Act that would allow any Tennessean to not purchase health insurance and also to not be fined by the federal government for failing to do so. North Dakota is passing a similar bill that would allow North Dakotans, again, to not purchase insurance except under limited circumstances and at their own will, and again, not be fined or penalized from the federal government. Why are they doing this? A couple issues. One is it's the factor of the constitutionality. A lot of states, 26 in particular, have sued the government, saying that it's unconstitutional to force somebody to buy a good or service, and then if they don't, to be taxed or penalized for failing to do so. The other issue has to do with their budgets. With the recession, the Great Recession, as everyone calls it, unemployment rates have gone up. What that does is, with this lack of jobs, a lot of people don't have health insurance, so now they're on the Medicaid rolls. So Medicaid costs have gone up. The states and the federal government share the cost of Medicaid, so a lot of these states are now burdened by this increase in Medicaid costs. Wisconsin is making a ton of noise in the press lately, and not just on the budget crisis, but on healthcare as well. Recently, Governor Walker accepted $30 million from the feds to start building the exchanges, but he did it with a caveat. He, along with 20 other Republican governors, wrote a letter to Kathleen Sebelius. She's the Secretary of Health and Human Services. In that letter, they asked for complete flexibility in operating the exchanges and operating it just as at a state level with no interference from the feds. Their reasoning was that they feel healthcare reform is actually going to threaten their state budgets. Again, it's the issue of how are we going to afford to operate and build these exchanges, and again, the constitutionality aspect of it as well. Those are the two main forces that are driving a lot of these states to establish laws that are allowing their residents to not have to implement or follow the healthcare reform bill. Thanks for tuning in. Take care.